Hypersensitivity is one of the favorite topics of examiner. Types and examples of hypersensitivity is a favorite question. In erythema nodosum leprosum, which is like a serum sickness like reaction, it is the type 3 hypersensitivity is what you come across. Mismatched blood transfusion is a type 2, and post streptococcal glomerulonephritis is a type 3. Then what is Schick test fundamentally? The Schick test is a hypersensitivity, more of a immediate type of a hypersensitivity generally. That is a fundamental difference. What is the difference between type 2 and 3, doctor? In type 2, antigen is fixed to the tissue, antibody is free floating, it recognizes the antigen and attacks it. Type 3 antigen is free, not fixed to any tissue, antibody is free, they both together form complex and they will go and deposit. Basic difference between the two. Okay. Now, the patient has a generalized edema, sweating, flushing, tachycardia, fever after the bee sting. They are all the classical examples of a type 1 reaction, which is a immunoglobulin E mediated reaction is what you need to basically remember. Can you quickly give what are all the examples of IgE mediated phenomena? The eczema, hay fever, asthma, urticaria, acute dermatitis and Theobald-Schmidt phenomena, they are all basically the IgE mediated phenomena. So in type 1 hypersensitivity, which is the immunoglobulin which is involved, it is the immunoglobulin E, IgE is the one which is involved is what need to be basically remembered, and it is the mast cell degranulation which will occur the moment IgE goes and attaches, and that lead to development of a type 1 hypersensitivity reaction. Then what is type 2 hypersensitivity among this? You know that Arthur's reaction is an immunocomplex deposition, so type 3. Then glomerulonephritis can be of type 3, or if it is good pasture then it is of type 2. But blood transfusion is what? Antibody is free, antigen is on the RBC membrane fixed, so it is attacking that. So blood transfusion mismatch reaction is an example of type 2 reaction, which is cytotoxic hypersensitivity is what you need to basically understand. So autoimmune hemolytic anemia, autoimmune thrombocytopenia, good pasture syndrome, acute rheumatic fever, myasthenia gravis. In myasthenia gravis there are antibodies against the receptors of acetylcholine which are in the fixed tissue at the neuromuscular junction. So it is also an example of a cytotoxic kind of a hypersensitivity, which is a type 2 hypersensitivity is what need to be remembered. What is Arthur's reaction? It is an immune complex reaction where there is a development of vasculitis, nephritis, arthritis and etc. And it is a classical example of a localized type 3, localized immune complex deposition is the underlying problem. Now out of all this which is not type 3, tuberculosis is a delayed type of hypersensitivity, as all of you know very well, which is not type 3. Whereas rheumatoid arthritis, SLE, Arthur's reaction, in all this there is an immune complex deposition is what need to be remembered. Then which is a type 4, once more a question of December 94, it is a granulomatous reaction, tuberculin reaction, etc. They are all delayed hypersensitivity, which is cell mediated immunity. Then epithelioid cell granuloma formation, lymphocytes, Langerhans Giant cells, etc., which you find they are all the features of a type 4 delayed hypersensitivity lead to this kind of a epithelioid cell granuloma is what need to be remembered. Then what are epithelioid cells basically? Another favorite question. They are nothing but the activated macrophages. They are large cells with abundant pale foamy cytoplasm. That is how you describe to a second year student, medical student, what is a epithelioid cell. You all remember our pathology PGs, first time they want to learn, they want to make it a habit of teaching, first lesson will be on epithelioid cell and caseous necrosis. Now let us go to the next question. Type 4 hypersensitivity, where do we see? Granulomatous reaction basically, tuberculosis, fungal infections, leprosy, etc. They are all type 4 hypersensitivity. Now one of the options given by Schwarzman's reaction, let us comment on that. What is a Schwarzman's reaction? Basically it is not an immune reaction at all. It is a two-stage reaction which you see in the gram-negative sepsis. The endotoxin initially produces a intravascular fibrin thrombi, and in turn it lead to the typical destruction. So it is not a immune reaction, rather it is not an immune reaction is what need to be understood. So quickly summarize: type 1, 2, 3, 4, atopies and anaphylaxis type 1, and Arthur's reaction is type 3, and tuberculin contact dermatitis are all type 4 is what need to be remembered. Then where we see delayed hypersensitivity, once more 97 PGI question, it is in contact dermatitis, graft versus host disease. What do you mean by graft versus host disease? You have transplanted a graft into the host, but the graft is not well irradiated. It still has some immunocompetent cells inside it, and it will recognize the host, like a teenage son argues with the father and thinks that he is right. But later on, when the teenage son becomes adult and then becomes a father by himself, then he will realize that all that argument was an unnecessary GVHD, graft versus host rivalry in the home. So GVHD is also an example of a cell mediated reaction of immunocompetent cells inside the graft attacking the host is the basic problem in these people. Now what is the primary role of T lymphocytes basically? Very fundamental question. They are important for the delayed hypersensitivity, but B cells are important for antibody production. Humoral immunity is all B cell, cell immunity is all T cell, all of you know very well. And you must be sure about complement system, another common question in the exam. Complements are classical and alternate pathway. There are two pathways in the complement system. Classical means antigen antibody complex will come and cause activation, whereas the surface of the pathogen is the stimulant which will cause complement activation in the alternate pathway. Whether it is classical or alternate, it will culminate at the level of C3A, and that in turn will finally produce C4, C6, 7, 8, 9, which is the terminal complement components which will cause membrane attack complex, as all of you know pretty well. Then what is the type 4 contact hypersensitivity? Is a type 4. Similarly, rheumatoid arthritis, peripheral neuropathy, multiple sclerosis, in all that there is a cell mediated reaction causing the disease, and even in type 1 diabetes, it is the autoimmune cell mediated destruction of the pancreatic islets in the embryonic life will make a person become insulin dependent diabetic is what need to be basically remembered. So that is all the story about hypersensitivity. Just you need to know what are the examples of different kinds.